us on the map. Mr. Caruana leading the beat. Australia global rank 6. Feeling the heat like immortality.
All right, so in this video, we're going to cover the concept of digital health. So the AIHW has a definition of digital health, which is it is systems, tools, and services using communication and information technology to help diagnose and treat patients, collect information, and share it appropriately. In other words, we're not looking specifically at technologies which provide curative or preventative or diagnosis, but it's about the information that comes from those diagnosis and analysis and how we can use that information to streamline the healthcare process. So good digital health will improve the quality and efficiency of shared information across all healthcare sectors, all right? So looking at, remember, Estonia's like e-health record, so that's what we're trying to get to, one central database where we have all this information and then we can distribute it to any healthcare provider in Australia that needs that information to more efficiently diagnose and treat patients. So the current National Digital Health Strategy, so current till 2028, focuses on improving this concept called interoperability. So interoperability is a special word, which is the ability of different systems and devices to access that shared health record information and then use it appropriately and accurately, all right? So if your local GP has a certain software suite that they use to store all their patient information, that information can also be used by the specialist centre down in Sydney, which uses a completely different software system, but due to interoperability, it's able to interpret that data from the GP, process it, and then streamline that healthcare process for the patient. And interoperability is actually really hard to achieve. Like if you look at the conflict between, Windows devices and Apple devices, all right, or Android phones and Apple phones, okay? We know that most things don't just easily go hand in hand. So this is a real focus of the National Digital Health Strategy, and it needs to be sorted out to make sure that the strategy actually works. All right, so what services exist under digital health, okay? So I've listed the three that we've already talked about in previous videos, so mobile health and apps, wearables, robotics, and AI, etc. But these are the ones that we're mainly focused on with this dot point. So telehealth and telemedicine really came about due to COVID, and then in 2022, it was actually recognized by Medicare as, can be claimed through gap fees, etc. So a couple of weeks ago, my daughter had a problem, had a sore on her arm, so we needed to find out what it was. So I went up to the chemist. Chemist said, oh yeah, I think I know what it is, but you'll need a script to get the medicine that's required for her problem. So I downloaded an app called HOLA, H-O-L-A, and put in the details, took a photo of the issue, and then sent it through the app, and they said, oh, a doctor will see you in like 30 minutes or something. So then what did we do? We went down, we got the car washed, and then on the way back from the car wash, the doctor called, pulled over to the side of the road, talked me through it, said, yep, looks like this, sent through an e-script, so linking to prescriptions there. And then we were back at the chemist, filled the script, and we were home by 7:10 or something. So it was really good. Like Friday night, obviously no doctors are traditionally open, would have had to wait till Saturday morning or whatever, and we just wanted to sort of get it sorted, and we did. And it was all covered by Medicare, so zero out-of-pocket costs, except for the medicine. So that was good. Electronic health records, so EHRs, the government is really trying to implement My Health Record at the moment, okay? So I mentioned in the previous video, everyone can go onto Medicare on the MyGov website and go to the My Health Records, and you can see current things like scans or pathology reports, etc. But they're trying to build it so everything goes there, okay? And that will be built through the use of the next one, which is healthcare identifiers. So every medical service in Australia is now being allocated a healthcare identifier number. It's like a serial number, okay? Not a phone number. It's like a unique number that represents that building or that complex, or I think even GPs individually. So even if you go to like a GP clinic, I think each doctor has an individual healthcare identifier. And so if you go and see person for a problem, then they put all your details in, it gets sent through to My Health Record, and their identifier gets linked through too. So if you need to look up in 5-6 years time, oh, what did I do and what was that problem I had? You can go back onto My Health Record, you can see exactly what the problem was, the doctor's notes, and who actually diagnosed you and where that was diagnosed, because that information may be pertinent down the track in case you have ongoing issues. E-scripts, mentioned it before, but they're fantastic. Don't have to get paper scripts anymore. I don't have to go to a doctor. I'm actually currently waiting for my own e-script to be sent through, a renewal, which is good. It saves me having to go up to the GP. Yeah, so these are current services that exist in the digital health space. Okay, interesting heading to put in a video, but it's in the syllabus. To what extent has digital health been successful? Currently, mixed. Okay, so there are some good and there's some bad, and I've got all these points here for you. So users, so the people of Australia, can actually opt out of using digital health records and having their stuff uploaded to MHR. That's going to reduce the overall effectiveness and accuracy of the system for a couple of reasons. Number one, if you think about it, the people who are actively opting out are probably people who are seeing doctors and specialists and hospitals, etc., regularly, okay? If you didn't go very often, then you probably wouldn't care whether your information was there or not because there's little information. So that hurts. The other part that this hurts about, and I talked about in the previous video, is that how algorithms with AI are currently being developed. If people who are the ones needing the care and have diagnoses of issues are not getting their data shared into that algorithm, then that can shift the algorithm towards a more positive bias, and therefore it can miss diagnosing issues. So positively, we've got 98% of current GPs, pharmacists and public hospitals in Australia registered with MHR. So all of the records that are going through 98% of all these clinical people are being uploaded to MHR. And that's excellent, okay? 2%, it would be better if it was 100%. And that's where the National Digital Health Strategy is aiming, 100% adoption, okay? The usage and the info being uploaded to MHR is increasing, okay? So for example, last year alone, there was a 50% increase in pathology and imaging data on my health record. However, back to a negative, only 20% of the data that is uploaded to my health record is actually useful, okay? As in, it is detailed, it has context behind it. For example, if you're getting imaging, the actual images are on MHR. If you're getting pathology, the actual results are on MHR. A lot of the detail at the moment, so the 80% of all the stuff that is being uploaded to MHR is just general information, as in patient went to a doctor. I'm sure it's probably a little bit more detailed than that, but not really contextual cause and effect, presented with these symptoms, recommendation, diagnosis was this, such and such and such. Okay, that's the type of detail that we need to actually make our digital health records useful long-term for consumers in Australia. And at the moment, only 20% of that data is at that level. Back to our new fun word, interoperability still remains a challenge, okay, as many systems don't talk to each other. So you can imagine that different computer systems speak different languages, just how people speak different languages. And unless you are able to translate the data or translate your language, you're not going to understand each other, all right? And also, some establishments, so looking in the private sector and mainly around like nursing homes, aged care facilities, etc., they still use paper records, okay? So not everyone is adopting this whole digital health system, and everyone sort of needs to be on board for it to be completely successful. So it's mixed. All right, so finally, what are some challenges and some opportunities for the digital health systems in Australia? So access and equity. So I've got our opportunities in green and our challenges in pink, red, whatever. So opportunity. Telehealth overcomes geographic, language, and time barriers, all right? I've already spoke about this many times, incorporated early around the COVID era, and now it is great. If you can access it, which is the challenge. Reliable internet, particularly for people who live rurally and remotely. There are a lot of areas out there that still do not have reliable internet or fast enough internet access to do video calls, etc. Or if you are socioeconomically disadvantaged, maybe you just can't pay for NBN, etc. And also, if you have a disability and you can't use a device, I spoke in the video yesterday about certain devices which enable you to control digital devices just using head movements and, biting down with your mouth, etc. But a lot of people don't have those. So these are our challenges. Next one, we've got data sharing and systems. So the opportunity is that seamless data will be exchanging across all systems, and clinical settings will increase healthcare efficiency, okay? The challenge is that the lack of interoperability and technical support staff actually working in the health space in the technical department, reduce the data sharing effectiveness. All right, so data sharing is an amazing thing, but everyone has to be on board, because if there's sort of one piece of the puzzle that's not shared, then you can't complete that puzzle. Consumer engagement. So the opportunities at the integration of like your wearable devices and apps going straight up to My Health Record. So imagine if you went and see a GP, right? And you said, oh, I've been experiencing chest pain lately. Instead of the GP sending you home with like a wearable ECG for a week, he can look up MHR and he can see from your watch, for example, how your heart rate and your blood pressure and stuff has been over the last month, 6 months, etc., which would drastically speed up the efficiency of that process. So that would be amazing. And I think that's definitely a big opportunity where we could be heading. Negatively though, the lack of health literacy in Australian consumers, okay? So a lot of people may have wearable devices or whatever, but they don't use them because they don't understand what the data means. They don't know that if they get 5.5 hours of sleep every night, that's not really okay. They don't know that having a blood pressure of 145 on 90 is not really okay. They just look at that and they're like, oh, that's just my blood pressure, and oh, that's just how much I sleep. So that lack of health literacy really makes making changes for consumers challenging. And then finally, the security and the privacy issue, okay? So we do have the Privacy Act from 1988 and the My Health Record Act from 2012 does provide a legal framework to protect the data from external influence and hacking, etc. And if it is externally altered or hacked, then obviously the people that have done that will have drastic legal consequences because of this legislation. However, having centralized healthcare data stored in one place still is going to carry that risk that people are going to try and access it and hack it. I don't know why, because why would you? Anyway, people will do it because it's fun or whatever, or they're just like, messing up the system, but, get a life. Anyway, that's a problem. So there are challenges and opportunities, and that is the end of our video on digital health. Thanks.